Assalamu alaikum doctors. In this video I am discussing recall communications, that is a UTI patient and a recurrent UTI, so we need to do the DMSA scan. So how can we tell that? We know some idea I am giving about DMSA scan. Look the pictures. It is a gold standard to localize the site of infection during an episode of suspected acute pyelonephritis, helps in localizing site of renal scanning to detect anatomical abnormalities and differential cortical function. So as usual, we are talking about IRCAP. I am here to talk to you about our plans for Ali, and hopefully at the end of the meeting I can take your agreement. Okay? But first, do you want anyone to be here? No. So how much do you know about Ali's conditions? So Ali has repeated infection in his urine that told me to come here and to do certain procedures. I do not remember what is the procedure. Okay. So as you mentioned, Ali had repeated infection in his urine. So our consultant asked us to take a consent for a procedure called DMSA scan. Did you hear about it before? No. So it is a procedure in which we will inject specific dye. It is a chemical substance. So specific dye chemical substance through the Ali's blood tube, and we will take a picture of his kidney by a special camera. So we are giving special dye or chemical substance to the blood tubes of the kidney, and then the special camera picture we are taking. So why you are doing it? It is very important. It tells us about the size of the kidney and if injured or damaged tissue in the kidney. Why it is different from jelly scan? So the jelly scan tell us about the size of the kidney but cannot tell us about the structure of the kidney and whether there is any damaged tissue or not. Am I clear? So jelly scan only size of the kidney but no structure. Is there any damage present or not indicating. Okay, could I explain for you the drawbacks of this procedure? Okay, for any procedures, as you know, there are some drawbacks. There is some risk of allergy. We will be ready with a medicine to give him if any reaction appeared. Also, there is some risk of radiation, and it is equal to what we get from background environmental radiations and very long period of time. Are you with me? So side effects or allergic reaction can be occur and the radiations. So okay, is this the damage to kidney diagnosed by DMSA scan is irreversible? No. I'm so sorry to tell you that the damage is irreversible. So why you will do that? Actually, it is very important to know whether he has damaged tissue or not, or the amount of damaged tissue, and whether the damaged tissue at one side or both sides. So it is very important to know. So can you explain more? For sure. For example, if one side only damaged and small may not need to follow up. Just discuss it with the kidney doctor according to family risk factor having hypertension. But if he has both sides are affected and large amount of damaged tissue, we need to measure his blood pressure every year and kidney function test every 3 to 4 years, and when he grows up he has to follow with the kidney doctor. So first of all, it is very important because any damage occur or not, if it is one side very small, may no need to be follow up, but if that is big, we need to follow up his blood pressure, his family history and his kidney function test. Accordingly we will proceed. So now he has some urgency and frequency. Can he do it? No, he has to wait for another 4 to 6 months. Why? We cannot do it while he has UTI. Also, it will give us inaccurate results. Okay, during UTI we are not doing that. So any precautions? Yes. For first 24 hours, he drinks plenty of fluid as much as possible. Allow the dye to go out from his body. Also, if he is taking his medication, to take it as usual, and he should go to toilet as frequent as he can and wash his hands as well. He will drink plenty of water because the dye will be come out from his body, and also he wash his hand properly. And we will change, if he is on nappy, change frequently. I am pregnant. You should avoid the contact with his fluids, pee, poo and throwing up. So contact of the fluid, pee, poo, throwing up. If he wears nappies, he must change his nappies as frequent as you can, and you have to dispose the dirty nappies and wash your hands very well. Summary, website, leaflet, support group and constant. So this is all about DMSA scan. Thank you.